Hello friends, welcome back to Complete Medical Coding. Today I am here with one of the two main modifiers 51 and 59. Okay, almost everybody knows what is modifier 51 and what is modifier 59, but let's learn in detail about these two modifiers because few people will be having confusion while coding these two modifiers, while coding with these two modifiers. Although it looks same, but there are differences in that, few differences in that. Okay, so let's learn in detail with some examples for these modifiers. Friends, if you are new to the channel, please subscribe and let's move to the video. So, what is modifier 51 and what is modifier 59? Okay, modifier 51 versus 59. What all are the similarities? What are the differences? Okay, what are the do's and don'ts? What is the importance of using 51 and the importance of using 59? Okay, with some examples. This is what we are going to learn today. Okay, what is modifier 51? 51, as you already know, 51 modifier represents multiple procedures, right? So 51 modifier, it is used to identify the secondary procedure or additional procedures. It is not appended to the primary code. Okay, 51 modifier represents multiple procedures or always. Multiple procedure in the sense the same procedure which is repeating again. So it means it will come as a secondary procedure, right? The same procedure repeating again will be the secondary procedure. You have to always append modifier 51 along with the secondary procedure, and you should not append it to the primary code. Okay. Anyway, all the modifiers, you should not use it on the primary code. You have to use it on the add-on code only. Still, if like 51, what does 51 represents? Modifier represents multiple procedure. Okay, so for the same procedure, even though the code is not primary, even though the code is secondary, and then the tertiary code is coming. For example, I am telling, okay, like secondary and tertiary are the same services. I mean multiple procedures. Imagine like that. Suppose secondary and tertiary are the multiple procedures. So in that, you should not append modifier 51 to the secondary code. You have to append modifier to the tertiary code. That is what it means. Okay. Among the common services, among the similar services, you should add 51 modifier to the secondary service. That is what it means. Okay. Not appended to add-on codes or modifier 51 exempt codes, which is found in Appendix E of CPT. Okay. Another one, you should not add 51 modifier to any add-on codes. You have to always use 51 to the main codes and not the add-on codes. Okay. And 51 exempt codes. Now, refer to the surge indicator in the Medicare physician fee schedule database to determine if CPT modifier 51 is applicable to a particular procedure code. This is as per the Medicare guidelines. Okay, as we are, since we are following the AAPC guidelines, so as per the Medicare physician schedule, you can refer always whether the multiple surgery indicator in the Medicare physician fee schedule database. Okay, yeah, to determine if CPT modifier is applicable to a particular procedure code. There is some particular table, okay, which indicates, which will show whether that whether the CPT modifier 51 is applicable to a procedure code or not. We will look into detail while doing the like more questions. I'll explain it in detail. Okay. Now, what is modifier 59? 59 is distinct procedural service. Modifier 59 represents distinct procedural service. So, appropriate use of modifier 59. How and when we will use modifier 59? What is appropriate use of modifier 59? Okay, it's a distinct and independent procedures. It's a distinct procedural service. It's an independent procedure. It can be used in different anatomical sites. Also, it can be used in same anatomical site but at different times, not in the same time. Okay. Also, it can be used along with diagnostic and therapeutic procedures. So, distinct procedural service, separate independent procedure. That is what 59 modifier means. Now, let's just have a comparison among modifier 51 and 59. 51 modifier represents multiple procedures, whereas 59 modifier represents distinct procedures. 51 modifier extra procedure in the same session, whereas 59 modifier separate procedure in different sessions. 51 modifier extra procedure in different site. 59 modifier distinct procedure in different site. Okay, if it is same anatomical site, it will be at different times. I mean, what did we learn before? If it is in the same anatomical site, it will be at, yes, different times. Okay. Now let's look into one or two examples in order to make you understand better. The first example. Meredith has breast cancer on the left side, diagnosed by an excisional biopsy performed last week. Today, she is having a radical mastectomy, urban type, and concurrently a single pedicle tram flap reconstruction supercharging. What CPT codes are reported? So, here if you check the CPT code, you have to code for the breast reconstruction procedure as well as the mastectomy procedure. Both you have to code, right? Because the patient is here. The patient is already diagnosed as breast cancer. Today, she is having mastectomy. Okay. And also, tram flap reconstruction, that is breast reconstruction procedure. So, both you have to code. So, if you go to the first one, 19368. Since here the procedure is carrying out on the left side, it is appended with a modifier LT. So 19368 means breast reconstruction with single predicted transverse rectus abdominis myocutaneous flap, that is tram flap. Okay, that's a full form of tram flap, transverse rectus abdominis myocutaneous flap, requiring separate microvascular anastomosis. So breast reconstruction procedure, you have to code. Along with that, you have to code the mastectomy also. So mastectomy, so it's a multiple procedure on the same side. So multiple procedure. In the second procedure, mastectomy, we are appending it with modifier 51 and also LT modifier because it is the procedure is carrying out on the left side. So 19306 for mastectomy radical, including pectoral muscles, axillary and internal mammary lymph nodes, urban type operation. Yes. So this is the code for mastectomy. So mastectomy 19306, you have to append it with modifiers 51 and LT. Okay, so for multiple procedure, you have to always mark multiple procedure, the modifier 51 in the secondary code. Okay. Another example, patient presents with lesion of lung and arm. FNA was performed, FNA means fine needle aspiration. Okay, was performed for lesion of lung with ultrasound guidance. FNA of lesion of arm was performed with MR guidance, magnetic resonance imaging, MRI. Okay, MR guidance in the same session, same day. What are the appropriate CPTs for the scenario? So here FNA is done. Fine needle aspiration biopsy is done. Okay, including ultrasound with ultrasound guidance. The first lesion. So lesion of lung and arm. So initially lesion of lung is performed and then secondary the lesion of arm was performed with ultrasound guidance. So you have to code both. You have to code the second procedure with modifier 59 since it's a distinct procedural service. So 10005 fine needle aspiration biopsy including ultrasound guidance, first lesion. So for the first lesion 10005 The second lesion code is 10011. Fine needle aspiration biopsy including MR guidance, first lesion. No, sorry, this is not the second lesion. This is the first lesion itself, but on the different site. Okay, same lesion, first lesion only, but on the different site. The initial lesion was for the lung, and the second lesion was for the arm with MR guidance. So, for the second one, you have to append with modifier 59, since it is a distinct procedural service performed on different anatomical sites. One is lung and one is arm. Okay. Now let's look into one more example. Modifier 59 example. Okay. 6-7 here, these are the this is not actually an example, just a comparison of two codes, 67210 and 67220. What is 67210 means? 67210 means destruction of localized lesion of retina, one or more sessions, photocoagulation. And 67220 means destruction of localized lesion of choroid, photocoagulation, one or more sessions. So these are just the CPT descriptions of 67210 and 67220. Now we are checking whether we can add modifier 59 in if the documentation is there along with, like, if a question which includes these two CPT codes. Let's see how we will code this. CPT code 67220 should not be reported and modifier 59 should not be used if both procedures are performed during the same operative session, because the retina and choroid are contiguous structure of the same organ. See, we should not report both these CPT codes together. Also, we should not report 59 modifier. If in case you are, if both sessions, if both procedures are carried out, also you should not code both the code, and you should not append modifier 59. Okay, using the second code, you should not add modifier 59 because retina and choroid, where are the sites here? Retina and choroid. So retina and choroid are the parts of the same, the contiguous structure means the contiguous structure of the same organ means eye. Same organ means sorry, eye. So on the same organ, it's a contiguous structure means it is just retina and choroid are just separated by a small wall-like structure. That is why it is a contiguous structure. So you can't, in such cases, you should not append any secondary. You should not code the secondary code. Okay, you should code only 67210. Can't code even the second one. Also, you can't append it with modifier 59. That will be a wrong coding. Okay, that's what it means. So friends, these are just few examples, and moving forward we will discuss more examples, more questions, practice questions in detail, which includes modifiers 51 and 59. Okay, so friends, if you find this video useful, please like and share. Please support me and please subscribe to my channel. And thank you so much, friends. And I'll be coming back with more questions in the next episode. Thank you so much. Bye. Take care.